Jessica, and thank you, Scientex conferences. Let me pull up my slides here. Jessica, am I coming through okay? Can you see my presentation?
Well, I'm not Jessica, but still, yeah, we
oh,
can.
I'm sorry. I'm sorry. Okay,
Yeah, that's fine. That's fine. Thank you. You can.
great. Thank you. So today we're going to be speaking about a novel approach to screening and treatment of cervical cancer and dysplasia using a novel vaginal speculum, visual inspection with acetic acid, a handheld colposcope, and canister-based cryogen for approximately $3 per woman. These are the components of the kit. Right here, the Bouquet speculum, the canister-based cryogen, the vinegar in a cup, and this handheld gynocular colposcope. As far as disclosures go, I did invent, I'm a family practice physician who invented and patented and got FDA clearance for the novel speculum to visualize the cervix. Cervical cancer kills over 300,000 women every year. As the second most common cancer affecting women in developing countries, it results in significant morbidity and a negative economic impact to communities, particularly those with matriarchal societies. The human papillomavirus, HPV, is the single most important risk factor for cervical cancer. Routine gynecologic screenings are effective in preventing cervical cancer, and there is a high cure rate if detected early. Excuse me. This is a recent map of the incidence of cervical cancer. You'll see that it's primarily focused in Asia and Africa. The concerning part is that the incidence to mortality ratio is about 50%. Currently, in low resource countries such as in Asia and Africa, we have several barriers to screening and treating of cervical cancer and dysplasia. One is the existing Pap test. It is not a point of care, usually, unless you have a pathologist present on site, and so it has to be sent to the lab and processed. The woman would have to be recalled for treatment. Sometimes we lose these women to follow up. Secondly, particularly in obese and overweight and multiparous women, the existing two-bladed speculum allows for lateral vaginal wall collapse, as we can see here in this picture. The lateral wall at the 9 o'clock position is starting to collapse and obscuring the view of the cervix completely. Not completely, but a partial obscuring of the view. We also have two methods recognized by the World Health Organization for screening and treating, for treating cervical dysplasia and cervical cancer, and that is the cryoablation and the thermoablation. These units rely on electricity, and some of the villages that are doing the screen and treat clinics are unable to provide electricity to these units. HPV is a necessary cause of cervical cancer in 99.7% of cases. The HPV subtypes 16 and 18 are the predominant subtypes for causing cervical cancer. There are two methods of screening for cervical dysplasia, the two classifications. One is the Bethesda method. For the purpose of our study, we're going to be using the CIN grading system. Currently, we have essentially three methods for screening for cervical cancer and dysplasia. Pap test, as mentioned, the HPV probe, and visual inspection with acetic acid. We find in low resource countries that the visual inspection seems to be on par with the others as far as accuracy and safety, but its advantage is that it's practical, it's portable. We can put this in a small kit. It's affordable, and acetic acid or 3 to 5% vinegar is readily available. So what is visual inspection with acetic acid? When we apply vinegar or acetic acid to the cervix, it creates a cryoprecipitant that is well demarcated here. So these are AW or acetyl white lesions that appear after the vinegar is allowed to sit for about 40 to 45 seconds. These are benign Nabathian cysts, nothing to worry about. The World Health Guidelines recommend, in terms of the use of cryotherapy for cervical intraepithelial neoplasia, to go ahead and use cryotherapy over no treatment at all. The quality of the evidence is strong. Japaigo from Johns Hopkins has developed some flashcards to help train local providers for this VIA method of screening for cervical dysplasia and cervical cancer. And so that the goal is to make this a sustainable clinic that the people in the village or in the town or in the city are able to be trained and continue to do these clinics.
それは出ないです。
I'm sorry, Mr. Yes, I think you're unmuted.
多分9時からのこれでいいと思うんですけどね。
I'll proceed. That this represents a acetyl white lesion at the cervical os in about the 4 to 6 o'clock position. And this is amenable to cryoablation. However, this has the warty appearance of cervical cancer. It's very friable, it's bleeding. This represents cervical cancer and is not amenable to cryo. Thank you, Jessica. And this is not amenable to cryoablation or thermoablation. As mentioned, I invented about 25 years ago a new vaginal speculum that keeps the lateral vaginal walls from collapsing and obscuring the view. This is one of the barriers. Besides the lateral vaginal wall collapse, we also have fear of embarrassment, pain, and discomfort from this procedure. So the claims that we have for the new Bouquet speculum is that it's easier to use for the provider, and so we can train ancillary personnel to do these screenings. It provides a better visualization of the cervix and improved comfort for the patient. We did some wet lab studies at Florida International University, regarding the existing 2-bladed plastic speculum versus the 5-petaled Bouquet speculum. And at lower pressures, both could see the cervix pretty well. At higher pressures, we start to see the vaginal wall collapse. Also, the force of distribution within the vagina is radially distributed as opposed to vertically. And so we find that it's less uncomfortable for the patients. We are about to undergo a phase 3 clinical trial in Nyeri County, Kenya, regarding the cervical cancer cure kits using the medical freeze spray or the canister-based cryogen, the Bouquet speculum, and the gynocular handheld colposcope. This is going to start in early December. The hypothesis, and I'm working with 3 students and a PhD from my university, is that we have been using things like Veruca freeze, which is a canister-based cryogen, medical freeze spray, and super cold in our practice to freeze cutaneous warts, which are caused by HPV as well. And the hypothesis is that this would also work on this cervical epithelium. So the expected outcomes for this study, and this will be a year to a year and a half study, will be that canister-based cryotherapy should be an inexpensive added modality for the World Health Organization to consider in their guidelines for the treatment of cervical dysplasia in low resource areas. We are going to do a literature review, and it is expected, again, that the canister-derived cryotherapy will be as effective in clearing cervical dysplasia as been shown with other cryoablation. We did a pilot study back in 2017 and 2018 that was published 2019 in the Journal of Women's Healthcare. And this was regarding these kits that we use in Peru, Paraguay, and Panama. The objective of this study was similar to the one that we're anticipating in Kenya. We didn't have follow-up, however, and so we are going to document these findings based on the images that we obtained from the colposcope. Here is the kit again. Once again, this is a canister-based cryogen. We can screen and treat 20 women with a backpack or a duffel bag size kit. The handheld colposcope, I'll show you here in a minute, but literally can fit into this duffel bag or into the backpack. Here are the contents of this, and through my nonprofit, we donate the Bouquet speculums. We also donate the light source and the canister, and I work with Project Cure, and so they donate gloves. KY jelly, vinegar will be obtained in country, large cotton swabs, same for those, and they'll be laminated instructions for use. These are some of the instructions. Briefly, we snap the pen light into place. These are the models that we use for our students at our university. We apply KY jelly as a lubricant. We insert it into the vagina and push the dilator forward, and then we get a clean view of the cervix, at which point we put 5% acetic acid to the cervix. We wait 45 seconds and observe for acetyl white changes. If there are any acetyl white changes that are appropriate to be treated, we go ahead and saturate a large Q-tip with a canister-based cryogen, and then apply it for 3 minutes. We let it thaw for a minute, and then we repeat. We then remove the speculum and save the pen light. These are disposable speculums, single-use speculums. So In Peru, we had our first study done with one of my colleagues at Vista University, and sampled the Bouquet speculum, and VIA revealed none of the 7 ladies had any aceto-white lesions. Project Cure has also been very important in setting up these studies for us and providing us with supplies. Project Cure is the largest supplier and distributor of used and new medical equipment to low resource countries. They go to over 113 different countries. This is down in Paraguay in 2017 with the use of vinegar and the Bouquet speculum and the canister base cryogen. This is in Panama in February. Here are the results of the study. They revealed that we studied over 224 ladies, 24 of which had aceto-white lesions that were treated. As mentioned, this was a pilot study. We did not get to an opportunity to go back and check after 6 months to see if the aceto-white lesions had cleared, but that's the purpose of this next study. So Dr. Daniel Kamani out of Kenya is a gynecologist and oncologist. He did receive the colposcope. I donated that from my nonprofit, Cure Cervical Cancer Incorporated, as well as the Bouquet speculums and the canisters for cryogen. This is Dr. Kamani in the yellow sweater outside of his clinic in Nyeri County. And this is Dr. Bonner. He's at Emory University, but he's from Chad, and he plans on instituting this screen and treat method in Chad after the first of the year. Here's the handheld gynocular. It's very small and fits in easily into a duffel bag or suitcase or backpack. We partner with Professionals for Humanity as well as Wu Teen. Dr. Bonner is the president and CEO of Wu Teen in Chad. And Up Health Foundation, Dr. Akima, is planning on in early January or February in Cameroon conducting screen and treat clinics using these cervical cancer cure kits as well. Also, there's another small clinic, Faith Gardens Medical Foundation in Cameroon, with a Dr. Samuel who plans to institute this after the first of the year. So we'll have several, maybe 4 or 5 sites where we're using this. Here are my references. And I wanted to open it up for any questions that anyone may have.